Joining me now, Olivia Walton. She is the founder and CEO of Ingeborg in Net Investments, and she has been a leader in Arkansas on maternal health improvements. Thank you for being with us, Olivia.
Thank you for having me.
I'll have to mention the other hat that you wear. You are also the chair of Crystal Bridges Museum of American Art, and you lead some interesting conversations with movie stars and television personalities on a regular basis.
It is a great privilege, and I want everyone watching to take this as an invitation to please come on up to visit us.
It is definitely worth it for sure. All right, let's talk about maternal health. We accomplished some great things in the most recent regular session of the Arkansas legislature. You have written a national op-ed on this. I believe it appeared on Bloomberg about some things that still need to happen, maybe at the federal level, and some other things that can happen at the state level. Let's begin with that op-ed. First of all, what kind of motivated you to write about all of this?
Well, Roby, thank you for all of your support in helping raise awareness about our maternal health crisis here in Arkansas. You really have been a great champion, and I appreciate how often you've used your platform to tell these really important stories. I actually wanted to raise awareness. I went in USA Today, and I'm grateful to them as well for publishing it, because we're gotten a lot of stuff right actually in the last couple in this last legislative session and really in this past year or two. So we first started talking about this, 3 years ago. We were the highest state in the country for maternal mortality, and people didn't even really know that. That is not the case anymore. And Governor Sanders gets a huge amount of credit for really taking this on and showing incredible leadership. She is actually outpacing other conservative states, leading with pro-family policies. So I wanted to write it about some of the things that I think we're actually getting right here in Arkansas, to shine a light on that, and also talk about what I think we still have to focus on, which is expanding paid leave, the child tax credit, and also making childcare more affordable.
Let's talk about those three things specifically. So, the child tax credit's pretty straightforward, paid leave, pretty straightforward. Childcare is a particularly complex issue. So, talk first about the two easy issues, the child tax credit and paid leave. What do you want to see happen on that front?
With the child tax credit and paid leave.
Yes.
Yeah, well, the child tax credit, I think is one of the most powerful anti-poverty fighting tools we have. And I think it's vital that it gets extended, and also that we consider seriously making it refundable. Paid leave, very important. Again, look at what Governor Sanders did. She first, in the last session, expanded paid leave to all state employees, and then this time around came back and said all public school teachers also should have 12 weeks paid leave. I mean, this is just vital. It's an obvious one. Everybody knows we need it. Everybody wants it, and yet we can't get it done. So I'm really grateful that we have in Governor Sanders a mother of three who actually went back to work after having these babies and understands just what a critical support this is. It's an economic issue. It's not a moral one.
Let's talk about childcare which is a system, basically. You got to have a place when you go back into the workforce to leave your children to get early childhood education, to know that they're protected, to know that they're safe, to give working parents that option to get back into the workforce and earn. Do you have some thoughts on how, either at the state level or the national level, we put those pieces of the puzzle together for childcare? Because it's extremely complex.
Yeah, it's really hard. I mean, and as a mom, you've got to feel really good about where you're leaving your kids if you're going to leave them and go back to work. And I have that luxury of having the choice. For most mothers, this is not a choice. 75% of mothers of children under 5 are working and need to go back to work. So childcare, there is no silver bullet, Roby. There is a playbook, though. And I think the three things we should focus on here in Arkansas and nationally are decreasing regulation where it's burdensome, increasing and rewarding innovation, and working with businesses and communities to help them figure out what solutions work best for them. So I have some stats here that I want to share. You probably saw in Axios this morning, $17,000 per child is the average cost of childcare for a family in Arkansas. That's way higher than the average cost nationwide, even though the average salary in Arkansas is lower. So childcare in Arkansas actually is more expensive than in most other parts of the country. That's terrible. We also have childcare deserts in 55% of our counties. That means there's only one seat available for 3 kids who need that seat. I mean, this is really, really hard. Couple things we could look at for any businesses or employers watching. There's actually some federal money. It's federal tax credit called 45F. Um, Only a handful of businesses have actually used this since it came out in let's say 5 years ago. So there is money there. I'm always frustrated with underutilization of resources and funds that are available. There is actually some money there that has not been tapped. So that's one place I'd point you to. Um, and then I think the other thing is to really look at some innovative pooled models. This was really successful in Colorado, where groups of smaller employers figured out how to kind of share the benefits and the liabilities, because I do understand it's very expensive for small employers to do this. And yet people have figured it out. We need to figure it out too. It's a critical part of our economic infrastructure.
Yeah, and I think too, there need to be, to me personally, from what I've watched on this debate over the last several years, there needs to be some sort of state incentive, if not a federal incentive, to pay these workers more. You're really talking about people that earn minimum wage, taking care of children in an environment where there is a requirement for their educational attainment, and there's a requirement for the amount of safety that they have to provide to children. Like you said, people have to feel that their children are safe. And that's pretty difficult to do when you're just dealing with minimum wage on some of these employees.
Oh, you are so right, Roby. And actually, that's an area where I'm thinking about doing more is storytelling around the childcare crisis to show just how hard it is for these people who are taking care of our children, our most important asset. So I read a statistic recently, something like half of all childcare workers are actually on government assistance.
Mhm.
These people overwhelmingly are women who want to have their own families themselves. These are people that need to be paid well, rewarded for taking care of our children well, trained well, and they actually also need paid leave.
Yeah, no, I agree with that. All right, let's talk about another initiative that has launched here in recent weeks. It's the Heartland Forward Maternal and Child Health Center. You have been a part of this as well. Kind of explain what this center is going to do and how it's going to help with the maternal health crisis in Arkansas.
Yeah, it is a mouthful. Its acronym is 6 letters. Maternal Child Center. Nope, I got it wrong. Maternal and Child Health Center for Policy and Practice. It's a great idea though. And I think this could really be transformational. We got the idea out of New Jersey's playbook. Their group is called New Jersey Nurture. New Jersey, I don't know if you know this, has gone in 7 years from 48th in maternal mortality, 47th in maternal mortality to 28th.
Okay.
Mean, amazing progress. It's why I always say I like working on maternal health. We know what works, we're just not doing it. This center is going to dig deeply into what works, get the right people in the room, share the solutions, and help figure out what it actually takes to get them spread across the heartland and take root. We've got about $10 million in initial funding, and we're planning to start here in Arkansas and spread it hopefully across all 19 states of the heartland.
And it's my understanding too, there'll be a tracking of some statistics that will be helpful for us in terms of understanding the progress that we hope is being made from some of these initiatives in the last legislative session.
Oh, yeah.
Yeah.
You're wasting your time if you're not measuring it.
Right, exactly. All right, what's next for you in terms of your work on this issue? You've laid out a few things here that you know need to be done, but what are we going to see Olivia Walton putting her hands on in terms of moving this discussion forward?
I think we're going to double down on paid leave.
Okay.
It's a no-brainer. And now that we've got teachers, I think nurses need it next. And I think we're going to go for maternity leave first. Paid leave for all parents is wonderful, but I think we're going for maternity leave and think about these pragmatic wins we can get and build a broader coalition around who actually supports this and understands, what a vital issue this is for recruitment, retention, and to help stabilize working families.
I think you'll find allies in the state legislature for all of this. She is Olivia Walton. She's the founder and CEO of Ingeborg Investments, and she has been a leader on the maternal health crisis in Arkansas and making some positive changes to move the state forward. Thanks for your leadership on this, Olivia. I really appreciate you doing what you've been able to do for Arkansas.
Thank you, Roby. Always great to see you.